there were other families, foster families, birth families that could really use the type of interventions we were doing. And so while we grew, we included pretty much any family that has Medicaid and that the children have had trauma in some sort. And so that's how we kind of came about. We stopped using adoption related services as much because a lot of families thought we were an adoption agency. And when
Right.
we started working more with other families, some of them feared that we were going to try to take their children away. So we felt like our doing business as name kind of encompassed everything we've been doing since 2006. So that's where we are now, Family Enrichment Services,
Well,
mainly.
great. Thank you so much for that history. I always love learning more about our partners, and
Yeah.
I've been here for about 2 years and have had the pleasure of working with our counselors with our Chosen Family program. So from that, can you tell me a little bit about the needs of adoptive families and how they've evolved over the years, just in your experience? What are some trends you're seeing, and how is Family Enrichment Services adapted to meet some of those changes?
Of course. So I think a big thing that we've noticed is being an adoptive parent is hard. Being any type of parent is hard, but being an adoptive parent, you want to help our community and you want to adopt children, but a lot of times what we think the child needs, the education out there just isn't up to par. So I think, what we've seen is really being able to support the adoptive families because these kids can be tough. Not all of the kids. Of course, the kids that we work with are the tougher ones. We don't get to see the fairy tale great no behavior children
Right.
because they don't need counseling.
Right. They come to you when they need help, right?
Yes. So
Mhm.
what we've really seen is that adoptive families really need that support from the community, from their families, from everybody, because it's a big change from, having their birth children or no children to having adoptive children. So I think the biggest thing we see and what we really try to provide is that support because a lot of times they're overwhelmed. If they're adopting from foster care system, they have case managers in their home, they have guardian ad litems in their home, and then all of a sudden they adopt and everything goes away and they're all by themselves. And they might have adopted a 5-year-old, and when they become 13 years old, they're completely different with hormones and different behaviors, and
Yep.
they just need that support. So I really think what we've seen is being able to provide that support and guidance and just listening to them because sometimes, if they feel like they need to vent or talk about how they're feeling, they don't want to feel guilty about how they're feeling or judged. And so to meet them where they're at, just like we want them to meet the kids where they're at, we as providers need to meet them where they're at also.
Right. And coming to them with that realization that,
Yeah,
everybody starts at a different point. So
definitely. Definitely.
now, you mentioned you've been around since 2006 and have grown considerably over the years.
Yeah.
We all know that, the future, well, who knows what the future holds, right? But
Mm-hmm.
can you tell us a little bit about your vision for the future of the organization and what you really are hoping to achieve in the next few years?
Absolutely. So our vision is to help out our community. Most of our clientele in Pinellas and Manatee are Medicaid clients. So with Medicaid, that clientele sometimes can be lower income families, and we want to be able to support those families and adoptive families, everybody. So we're really trying to help the community where they're at. And be able to meet those needs because there's tons of private therapists out there, but not everybody can afford private therapists.
Right.
And the majority of our clients, we go into their homes
Mhm.
because a lot of our clientele have, if they are a foster family, they have several foster care kids. So to pack them all up in the car and come to an office, it's really tough. And going into their home, we get to really experience what's going in their home to be
Right.
able to support them where they're at. So in the future and now we continue to want to help the community in that way. Our goal is to continue providing that support. We were just awarded a grant from Orlando Health for mileage because our in-home program in Pinellas County, our clinicians didn't get mileage. And so we are able to pay them mileage now to help with that gap and to be able to help more families
Right.
get services because a lot of providers aren't able to go into the home. So we want to continue that. I don't think we ever want to be a big, huge agency. We like being small because you can more focus on the quality of care. But we just really want to keep supporting our community. We have started a new training module. So we're offering training, trauma training to professionals, to families, to foster families, and we want to step that up and add more trainings to that. So we just want to support our community, families,
Wonderful.
case managers, everybody.